Welcome to the pressure volume loops part 2. Here we are gonna do the basic pathologies or basic some conditions that can alter this graph. So first is the preload. See, when the preload increases, that is on this image, if we see that when the blood is coming to the heart, that increases, that is the preload is increasing. So more the blood will go into the lungs, more will come back to the left atria, more will go to the ventricle. So volume is increasing. At the end the volume is increasing. So the graph, see, you can see the green graph, the volume is increasing. So the normal volume was here, now it is going to increase till here. So this, because this is occurring due to the preload increase. The second is, if what happens if the afterload increases. Afterload increase means like, uh, basically we can have hypertensive conditions, or we can have decreased stroke volume due to hypertension, right? Increase aortic pressure, like aortic and we can say aortic coarctation of aorta or anything like that, or increase ejection systolic volume, right? So basically the resistance is increasing, which leads to the pressure in the ventricle needs to be more in order to eject the blood out of the heart. So ventricular pressure, ventricular contraction needs to be more in order to pump against the resistance offered by the vessels in the aorta and the systemic vessels. So here the volume is kind of similar, okay? But see, the main difference is the pressure increases. The ventricular pressure needs to get increased. So this is the afterload, this blue graph. Then is the contractility. When only the contractility is increased, for example, you can say due to exercise or due to anything like, which increases the stroke volume or the ejection fraction and decreases the end systolic volume, we have a graph that actually leads to the lower volume. What it means is that when the contraction is increased, the heart is pumping very rapidly, so there is less time of the ventricular filling. The volume in the ventricle will not be so much, because it is not getting enough time to get filled. So the volume in the ventricle will kind of decrease, whereas the pressure is okay, it's almost normal. So volume decreases in case of increased stroke volume or increased contractility, increased heart rate. Okay, so three things we have done, that is the preload you can remember as volume increase, volume hypervolumetric states, we can say. Afterload increase leads to the pressure overload conditions, and the contractility increase like hypothyroidism and exercise, etc. Now some conditions, we come to some conditions. Okay. Okay, so valvular diseases, if we talk about, first is the aortic stenosis. See, aortic stenosis is the blood cannot go into the aortic valve, right? Cannot pass through the aortic valve, cannot go to the systemic circulation. This is due to, you can say that the resistance in the vessel is increased, so it is increase in the afterload, right? The resistance in the vessel is increased due to stenosis, so this will be a afterload curve. Then we have the aortic regurgitation. We know aortic regurgitation, any regurgitation, that is the aortic or the pulmonary regurgitation, are the volume overload conditions. So Here, when the blood will go into the aorta due to regurgitation, when the ventricle will relax, the blood will come back. So the volume of the ventricle will get actually increased because the blood is coming from this mitral valve also, and now it is regurgitating from the aortic valve also, so leads to the volume overload. So volume overload curve. Now we come to the mitral stenosis. Now in case of mitral stenosis is that the blood do not efficiently come into the ventricle. So the volume in the ventricle reduces because the blood is not coming properly to the ventricle from the atria. So we can see the volume is decreasing when actually the mitral valve needs to be closed, and before the matlab, in the case of the isovolumetric contraction, the volume is decreased, right? And then we have the mitral regurgitation. See, mitral regurgitation means when the volume when the ventricle contracts, the blood goes back to the atria. But when the next contraction will occur, when the next rapid filling or the filling of the ventricle will occur, there will be double blood coming into the ventricle, so it will lead to the volume overload. So this will, the graph will show something like this: the volume is increasing. So that's it. So we will summarize once again, and what we see is you have to remember the graphs. As the first one was the first one was the aortic stenosis. That was the uh, the first one is the aortic stenosis, that after load increase graph. Then we have the aortic regurgitation, volume overload increase graph. Then we have the mitral stenosis, shift to left. Then we have the mitral regurgitation, shift to right, like kind of oval graph. Okay, just to remember.